5 common misunderstandings in neck-driven shoulder pain. 1, you don't have to have neck pain to have neck-driven shoulder pain. That's scapular pain and posterior lateral shoulder pain and most pathognomonic. Secondly, referred symptoms beyond the elbow does not mean it's the neck, so listen to that subjective and that pain behaviour very clearly. Clearing the neck is not about just looking at active range of movement. Remember, passive range of movement, overpressure and palpation are important parts of your assessment, and then we can use upper limb tension test to rule in, but not necessarily rule out. I mentioned palpation, so remember that's our number 4. When you palpate, comparable tenderness on the side of symptoms is sufficient. We don't have to reproduce the symptoms. And finally, whilst using neck movements, if the patient reports particular neck movements make their peripheral symptoms worse, then of course that's useful in weighing up our clinical reasoning. But from our perspective, if we do specific repeated movements and assess the effect on the shoulder, just remember that in 40% of people with no evidence of cervical spine involvement, it will have some effect. So as ever, our subjective is absolutely key.